Do you know how to identify a respiratory emergency on your patient with just one phrase? These are your respiratory red flags. These are your biggest priorities. So anytime you see these phrases on an exam or on NCLEX, you're going to pick them because they mean something bad. And let's see if you know what they mean. So we're going to go through each of these. I'm covering up the answers. By one phrase, you should be able to identify what's wrong with your patient. Let's see if you can do it. All right, your patient has pink frothy sputum. This is a big giant red flag for NCLEX, okay? Pink frothy sputum. You see that? That's a priority, and that means pulmonary edema. All right, so this could be in a CHF patient. This could be a patient in COPD exacerbation, okay? If you see pink frothy sputum, that is a red flag for pulmonary edema. You need to move it, okay? All right, next one, new onset stridor. Now, they may present this as a toddler was playing on the floor, and all of a sudden they have new onset stridor. What is wrong with this kid? Foreign body aspiration. Okay, so that is a coin, something they have sucked into the airway, and stridor is upper airway, up in the throat. So it's, okay, so it could be foreign body aspiration. You may also see new onset stridor if they say a patient was previously in a house fire or had been in some kind of smoke earlier today, and now they have new onset stridor. That's a red flag. We're losing their airway, okay? All right, let's see if you guys know this one. This is very big for NCLEX. This is what we call the 4 Ds: dysphonia, dysphagia, drooling, and distress. Dysphonia means that there are dysphagia with a G, okay, it means that they are having trouble swallowing. So they can't speak very well, they're having trouble swallowing, they are drooling, and they come in distress. These kids are pissed. They usually come in leaning over, they're in tripod, and they're drooling pretty copiously. You have got to know this one. This one is epiglottitis, and your priority for epiglottitis is to immediately get a trach intubation kit because their epiglottis is so swollen, we're not even going to be able to intubate them in the normal way. All right, so you need to get a trach intubation kit. All right, this is also very big on exams and NCLEX. A patient comes in with asthma exacerbation. So they were coming in, that's why they came into the ER, but they are not wheezing. Now on an exam, you're gonna be like, oh, that's so great for them. They're not wheezing. No, girl, this is a red flag, okay? Asthma exacerbation without wheezing is what we call silent chest. This is a giant red flag. That means that their airways are so swollen that you can't even hear airways. You can't even hear them wheezing because their airways are like this, and they can't get anything through. Silent chest. We want our asthma patients wheezing. Okay, no, I don't want everybody wheezing, but I want our asthma patients wheezing because at least then I know that we're moving air and the chest has not gone silent because they can't move air. All right, next one. This is also a very big one for trauma. Shortness of breath, sudden shortness of breath, and tracheal deviation. That one is a tension pneumo. This is an emergency. They need a chest tube. You should know tracheal deviation means a tension pneumo. That is big, big, big in trauma, okay? All right, patient, last one, restlessness and anxiety. I put this one also on my neuro video, neuro red flags, because restlessness and anxiety is something that you have got to notice.